I am so excited to stand before you this morning. I know we already started brunch, but I want to give thanks to the Creator for bringing us all here together and allowing us to share in such a beautiful moment once again at our annual Women's Health Day. I think I got a chance to see a lot of everybody in here today, but the room looks so massive standing up here. So I want to reintroduce myself to those who have met me and those who have not met me, right? So my name is Atiya Jaha-Rashidi, and I am the Chief Equity Officer and Vice President of Community Relations at Newark Beth Medical Center and Children's Hospital of New Jersey, part of the RWJBarnabas Health System. And again, we are so pleased to have a full audience back, to have so many women participate with us today. When we first came out of the pandemic, we limited the space and time, and we are very conscious and cautious in this space. So if you would like to mask up, please feel free to do so. We were able to invite over 600 women here today. Our president and CEO could not be here this morning, but he has a very special message for all of you.
Good morning. I'm Darryl Terry, President and CEO of Newark Beth Medical Center and Children's Hospital of New Jersey, and welcome to our annual Women's Health Day. Unfortunately, I can't join you in person this year, but I am told we have a packed house. There are more than 600 women registered to attend today's conference. I am excited to welcome you all, and I want to thank our esteemed panelists who are here today, ready to deliver sound health advice and answer your questions. Since our last event, we opened a new geriatric center at the Beth, the James and Sharon Maida Geriatrics Institute. We also have a new geriatrics unit designed to meet the needs of our seniors. And if you've been to the hospital in the last year, you may have noticed our Newark Strong lobby. The 17,500 square foot glass enclosed lobby has truly transformed the face of our hospital. And this is just the beginning. By the end of this year, our emergency department will be completely renovated. We will have expanded operating rooms and an expanded radiology suite. These upgrades and expansions are helping us deliver world-class care to our patients, but it's events like these that allow us to all be healthy together. I hope you enjoyed today's events, and if you learned something new today, use what you learned and share it with a friend. Thank you.
It is because of Mr. Darryl K. Terry, our President and CEO, that we are able to gather here. We started in the very small cafeteria space, quickly grew to our auditorium, and then we understood that we needed to reach more people, and as you can see in the room today, we have definitely done so. Before we begin, I would like to ask that we all take a moment of silence to honor two great friends of Newark Beth Israel Medical Center who are no longer with us. A few weeks ago, we lost the Honorable Congressman Donald Payne Jr. Congressman Payne Jr. was a great friend to our hospital and a great supporter of our Women's Health Day. In 2019, he was on this very stage, and he shared his health story and his personal struggles with all of us. That was just one of the many times he showed up for us and for our community, and he will be greatly missed. Earlier this year, we lost our beloved Dr. Patricia Bennett. Dr. Bennett was a gifted podiatrist and healthcare professional who lit up the stage with her dynamic responses and no-nonsense approach to delivering medical advice. Dr. Bennett will greatly be missed, but will never be forgotten, especially not at Women's Health Day, where we will be honoring her at future sessions. Her legacy will live on. At this moment, I'd like to take a moment of silence for Congressman Donald Payne Jr. and Dr. Patricia Bennett. Thank you. You all have to forgive me because I was very close to the both of them, and it's kind of hard to speak to them in that light, but I know that I stand on their shoulders, and they have a lot of wind beneath my wings right now as we go on with our day and make sure that we are pushing forth with health and wellness. At this time, I would like to also thank our volunteers from Newark Beth Medical Center. So if you see anybody in the purple shirts, these are all of our volunteers, somebody that's wearing purple. Essex County Nursing School, South Ward Improvement District, and the North Jersey Minerva Corporation for helping us make this day exciting and powerful. We're about to begin our programs. At this time, all sales and vendor activity will pause for the duration of the panel discussion. And now it is my pleasure to introduce our esteemed panelists. As I call your name, I ask you to come up to the stage and take a seat. Our first panelist is Mahtab Ayatollahi. Mahtab is the Director of Psychiatric Emergency Screening Services at Newark Beth Medical Center. She is a licensed clinical social worker with more than 11 years experience delivering trauma-focused therapy and social work services. Mahtab holds a BA in psychology from Rutgers University and Master's of Social Work from the University of Pennsylvania. Next, Rebeca Kane. As I look at Rebeca's long list of alphabet soup after her name, I will just describe her in her bio. Rebeca is the Assistant Vice President of the Advanced Heart Failure Treatment and Transplant and Ambulatory Cardiology at Newark Beth Medical Center. She is committed to delivering patient-centered care, encouraging patients to actively participate in their own medical treatment to improve outcomes. Rebeca received her Bachelor's of Science in Nursing from Rutgers University, a Master's of Art degree in Acute Care Advanced Practicing Nursing from New York University, and a Doctor of Nursing Practice from Drexel University, where she is currently an adjunct professor. Next we have Dr. Nisha Kumar. Dr. Kumar is the Division Director of Internal Medicine at Newark Beth Medical Center. She is leading our Beth Prime Care and Adult Health Care Centers practices. She specializes in treating chronic conditions such as type 2 diabetes, hypertension, obesity. She is passionate about increasing the access to both here and abroad. Dr. Kumar received her bachelor's degree of medicine, a bachelor of surgery degree from Shri B.M. Patil Medical College and completed her internal medicine residency at Jamaica Hospital Medical Center in Queens, New York. Next we have Erika Lannaman. Erika Lannaman is a registered dietitian at Newark Beth Medical Center. She provides medical nutrition and therapy to our patients at Newark Beth, guiding individuals on how to select the right foods, prepare and plan nutritious meals. Erika has a master's degree in community nutrition and is the recipient of the Outstanding Performance Award from Dale Carnegie Leadership Training, Immersion for Dietitians. Sorry. Next we have Dr. Norma Milanes-Roberts. Dr. Roberts is a board-certified physician with over 25 years of experience in the field of obstetrics and gynecology and infertility. In 2021, she received a special commendation from Newark's Mayor Ras Baraka for her leadership as the medical director of the Department of Health and Community Wellness during the height of the pandemic. In March 23, she joined the staff at Newark Beth Medical Center as a lead physician in our newly developed Centering Pregnancy program. Dr. Roberts completed her medical school and training at Rutgers University Medical School and her residency program in why can't I get that word out? Obstetrics. Thank you, guys. Bear with me. Next, we have Yvette Murillo. Yvette is an oncology advanced practice provider and a nurse practitioner specializing in sickle cell care at Newark Beth Israel's Frederick B. Cohen, MD, Comprehensive Cancer Center and Blood Disorder Center. Yvette works with a wide range of cancer and blood disorder patients, including those with leukemia, lymphoma, breast cancer, lung cancer, hemophilia, and sickle cell. Yvette received her Bachelor's of Science in Nursing from Western Connecticut University, a Master's of Arts degree in Family Advanced Practicing Nursing from C.W. Post Long Island University, and she is currently working on her Doctor of Nursing Practice from DeSales University. Let's hear it one more time for our esteemed panelists. So I'm going to join the panelists here because I have lots of questions. Some of these questions came from those of you who asked questions last year, and we thought they were strong enough to bring them back into the room today, and some of you submitted some questions, and then we have some exciting questions as well. All right, here's a rapid fire question for all of you, right? In one sentence, if you can only give one word of advice to women in this room today, what would you tell them? Don't everybody jump at once.
Hi, everyone. I could go first. So I'm going to tell you all the same thing that when I sit in a plane to take off to go somewhere, usually on vacation, I'm being told. And that is, in case of an emergency, when you see the oxygen masks dropping down, and it's you and your child or your partner or your mother or grandmother next to you, you are always to put the oxygen mask on first, on yourself, before you put it on anybody else. And I have the same advice in the work that I do in behavioral health and mental wellness, is that we cannot take care of our children, our sisters, our mothers, our grandparents, if we're not taking care of ourselves. So that's my one takeaway advice for today.
Love it. Thank you so much.
Thank you. Can you guys hear me? Yes, perfect. So first I'd like to say that I've never seen a room with such beautiful women since last year. So I just want to say that before we start. So my word of advice would be to show up. I know it's not one word, but we'll make it one word today. And that means that you have to show up for yourself, kind of what we heard, and show up for each other. And if you want to do something, even if you're scared or anxious or you've never done it before, I think the most important thing is to show up. So if you've never done yoga, today is an opportunity to show up and do it. If you want to lose weight, show up somewhere and make that a goal. If you want to exercise, show up and start walking around the block. So I think that it's important that we make small goals for ourselves, for our health, and we just show up. That is the hardest part, and that's the first step.
Hi, everyone. This is my first time here, and this is an amazing crowd. Thank you for having me here. My word of advice would be, speak up. And, oftentimes, we have thoughts that we want to keep to ourselves. We don't ask for help, but I feel like as a person, you need to speak up and ask for help. It's okay to ask for help because that's when you get help.
Hello, everyone. This is also my first year, and I'm excited to be here on this panel. My advice regarding nutrition would be to try to include as many whole, unprocessed foods in your diet as possible, and also to speak up, be honest. If you get advice from a dietitian or another health professional that you're not willing to follow, we need you to tell us so that we can work with you and figure out how to make it work for your lifestyle.
Hello. Buenos días. Okay, good morning. So I always struggle with one word, but I think it fits the sentiment and also how we are united today, the word of community. You have to trust, you have to join your community, and that does not necessarily mean your family. You can extend it, your church group, family, community, because in this rapid world that we're living in, with all the things that we hear, and all the things that we talk about, community is important. That's my word.
Good morning. It's my first year as well. I am so happy to be on this panel and among amazing women. It's just empowerment to all of us being together in one room. But my one word is, like everyone else says, it's very hard to say, but prioritize. Prioritizing yourself, advocating for yourself are two words that we have to take that to heart. Prioritize yourself, because if you don't take care of you, like everyone else said, you can't help anyone else. So prioritizing and advocating for yourself.
Thank you so much. I believe I'm just going to add my little one word in here because I'm taking civil liberty here. And I say my word is grace, right? We have to give ourselves and give others grace. Understand who we are, where we are, and why we are in this moment, and always be thankful. I always say the Creator is most gracious and most merciful, right? And so, again, grace is my word. Now, they got slick on me and tried to answer these questions in order, but I'm slicker, right? I'm going to now mix it up a little bit. So, Dr. Kumar, what is the one thing you would recommend we do to prevent a chronic illness? And if you're managing a condition like diabetes, hypertension, or the likes, what advice would you give the women in the audience today?
So as a primary care doc, I believe in preventive care. So I don't want to be having those conversations where I'm talking to you about how to control the blood pressure or how to control the diabetes. I want to prevent you from getting there. So we talk about how not to get there. I'm going to talk to you about lifestyle changes. I'm going to be a friend. I want to be that person that you can call me anytime. And, talk about exercise, lifestyle changes, food choices. And, I want to work with my colleagues here to prevent you from, getting high blood pressure or diabetes.
Thank you. Dr. Roberts, reproductive health is such a primary concern for women for most of our lives. Can you give us the best advice for women to maintain good reproductive health and to maintain our health post-menopause?
The key word, post-menopause. Right. I think that the best advice I can give is it's embodied by all the physicians and specialists that we have in this panel. First, you have to self-care. You have to make conscious and appropriate nutritional choices. You also have to rest. How many of us actually do rest? And how many of us actually at 3 o'clock in the morning are getting up and you can't sleep because a little bit of we can't rest? And how many of us actually go to sleep and think about, well, I have to get up tomorrow, I have to, my daughter, my son, right? We're not resting. And my esteemed colleagues here will tell you, rest is key. It's very important. If you don't rest, it leads to problems with diabetes and problems with hypertension and problems with anxiety and all these other things. Rest is important. And also, one thing that I do struggle with, because, I do have some problems with my knees, but we can move, right? And so I'm going to ask all of you, if you can't get up, don't get up. If you can't do the jumping, don't do it, but move. Move. Move your arms, move your shoulders, move. And that's important. My esteemed colleagues will tell you, when you move, you can rest, you can sleep better, your mental health improves, and your nutrition also improves. So those are my words. I think I said one long word.
Thank you so much. Rebeca, we know that heart condition can present very differently in women versus men. What should women look out for, and what can we do to take care of our heart health?
Awesome, great question. So first, I want everyone to look to your right and then look to your left and look at that person next to you. So 1 in 3 women are affected by heart disease.
Wow.
That means that one of the person that you look at, or yourself, will at some point have some sort of heart disease, and that could be hypertension, a heart attack. So how do we recognize that? How do we prevent it? The first step to recognition is not to ignore something. A lot of us, a lot of women, will ignore symptoms or ignore ourselves because we're too busy taking care of everybody else. Has anyone ever experienced that before? So, a lot of times you'll see on TV that someone's having a heart attack. So it's that elephant sitting on their chest. They're collapsing. They're like, oh, it's usually a man, right? Very dramatic. We've all seen those Lifetime and Hallmark movies. But that's not really how it happens in real life. It can, but typically it doesn't. So for a lot of women, we tend to have very mild symptoms that are clustered together. So for example, you're nauseous. You're just not feeling well. You're tired, and you think it's because you didn't rest. You have some dullness in your shoulder or in your back, and you just like you can't pinpoint it, but you know that it's annoying and it's kind of nagging at you. And now you put all those symptoms together, and you know that something is wrong. A lot of times we're afraid to speak up when we go to our doctors or our providers because you don't want to be silly, or maybe that's a symptom that, no, it's probably nothing, I'm not going to mention it. That is the worst thing that you can do. Mention everything. So last year, we talked a little bit about, if you feel something, do something. So that still, it applies today. You have to take care of yourself. So what can you do to prevent it? So your bodies are not Amazon Prime. They're not going to be here overnight. You got to work at it. So the first thing is nutrition, and we're going to hear from our colleagues about what good nutrition looks like. Exercise. Doesn't mean that all of us are going to leave here today and run a marathon, right? But we can move, we can do a little something more than you did yesterday. So that could be what we focus on. I'm going to do something today more than I did this morning or more than I did yesterday. Also, managing your stress and your expectations, because that could get you into this whole hamster wheel where you just can't keep up, and you're just constantly doing more and then trying to feel better, so therefore you're doing more because you're trying to feel better, and you just keep going, and then eventually you're going to tire out and it won't be a good thing. And the other thing that you can do is go get yourself checked out, because that's the most important part. When you go to the doctor, let them know, I'm only 21 again, so just for you guys that are wondering. I think I just turned 29 for like the 19th year this year. So, what tests are appropriate for your age? Have you had a baseline cardiac workup? Have you had an EKG? Have you had blood work? What is your cholesterol? What is your thyroid function? What does your sugar look like? Also, have you had an echocardiogram, which is the ultrasound of the heart? So in cardiology today, we have a lot of great testing. We have a lot of things that we never had years ago. There's no reason why we shouldn't utilize it, but you have to be your own advocate. So next time you go to the doctor, you need to ask them, what for me, if I was your mother or sister or cousin or girlfriend or wife, what test would you recommend for me at my age to prevent or know if I have any heart disease? Because you don't want to wait until you have it. You want to make sure you catch it early so we can treat it and it doesn't progress to having heart disease. Even though I work in healthcare, and I see a lot of patients that come in way too late, and that's never a good thing. The earlier, I know it's a really long answer, but the earlier they come, the more we can do.
A great answer. I think our president and CEO said it best. If you hear something, share something. And hi, my name is Atiya, and I have hypertension, right? A lot of people say that I don't want to admit this. I don't want to take medicine. I ride a bike all the time. I'm in great physical health, and I have cardiac history in my family. My mother, my paternal grandmother, cardiac disease, right? And so we got to first be able to speak up for ourselves and advocate for ourselves. So I think that was a great point, Rebecca. Thank you so much for sharing that. Erika. I think Rebecca tossed you the ball. I probably don't even have to ask the question, but in your work, you are teaching our patients how to incorporate healthy, nutritious foods in their diet in order to manage chronic illnesses. The illnesses Dr. Kumar spoke of, right? What is considered healthy diet? What tips can you give us to maintain a healthy diet? And is the word diet?
Thank you for the question. I could talk for an hour about this, but I won't. So the word diet has a bad reputation. It used to just mean what you eat. This is my diet, this is your diet. Now a diet is something that you go on, which that's not really the goal. The goal is a healthy lifestyle. It's something that's sustainable, that you can maintain over time, not so much a diet. However, I understand that sometimes we do have circumstances where we do need results more quickly to support health. And so what is considered healthy? In general, we want to stick to eating more whole foods. A whole food is basically a food that is its own ingredient. So when you look at the label, if it even has one, the only thing, for example, in apples is apples. The only food in chicken is chicken. So sticking to more whole foods in your diet is always a good idea, because when you get nutrients from whole foods, they come in a complex with lots of other components. There are vitamins, minerals, there's fiber, there might be some protein, there are plant chemicals called phytonutrients, there are antioxidants. So when you eat whole foods, you get a lot of these benefits, a lot of protective benefits. That being said, there are some foods that we do need to limit. I'm sure you've all heard this before. We want to be careful with sugars, more so added sugars than natural sugars. We also want to be careful of too much fat in the diet. There are some fats that you want to get more of, like your heart-healthy omega-3s, and your unsaturated fats. Saturated fats, we need a little, just not too much. And then we also want to be careful of sodium in the diet as well. And making sure we get enough potassium, too, to kind of balance out the effects. But ultimately, with your diet, you do want to have variety, because that can help to support your digestive tract. Your digestive tract really thrives when you're getting variety of different foods, plants specifically, different types of fiber. So variety, whole foods. I know we're in this day and age where there are so many convenient foods now, and it's like we can't go back. They're already here, they're delicious, we've tasted them once, you can't get it out of your head. It's a journey. So, grace, I really appreciate that you mentioned having grace, showing yourself grace, and trying not to compare yourself to somebody else. We all have different genes. We have to acknowledge that. And, we're all on our own journeys. It's not a race. It's okay with where you are. You're here now for a reason. You are where you are because of where you came from. And so now you're taking it upon yourself to get your health in a better place and move forward. So it's always good to work with a health professional, like a dietitian. We can help you set goals, small, manageable goals. You don't want to turn your life around all at once. Work with a few small things you want to change, including exercise, choosing more whole foods in your diet. And lastly, I would say, we do want to also keep in mind how we're preparing the foods as well. And so I'm sure all of you have heard to limit the fried foods and trying to include some fresh, uncooked foods, because some nutrients can get destroyed by cooking. So it's okay to have cooked foods, of course, but maybe throwing on some fresh herbs at the end to add a little boost here and there.
Thank you so much, Erika. I want to stay on this for just a couple of seconds. You talked about moderations. I remember my mom saying everything on your plate should be no bigger than your fist. Put some colors on your plate. Make sure there's something green on the plate. One thing I want to talk about is we spoke of whole foods, and I want to know how we get to manage whole foods without tapping into our whole paycheck? Because it seems like the more healthier the food is, right, the more expensive it is. And so how do we balance that with the spend in our intake as well? Because sometimes we make the choice by what we can afford to get.
That is completely true. And part of that is an issue that's bigger than this. We do need a whole system change, honestly, because it is ridiculous how much you may spend on a healthy food when the processed foods went through more machinery and they cost less. Right. So we do need to be aware of that as well. And so when it comes to certain foods like legumes, so beans, peas, lentils, those are always an excellent food to include in your diet. If you are open to buying those dry, you can save money, get more bang for your buck. You will have to prepare them at home, and you want to soak them overnight to get rid of those gas-causing compounds, which is how they used to traditionally be prepared. And when it comes to fresh fruits and vegetables, some of you may be wondering, do I buy organic? Do I buy not organic? The difference is basically the pesticide use. So what I normally recommend, if you find that you have a little bit in your budget to buy some organic, I would say if it's something where you peel, then you don't have to get organic. Whereas if it's something you eat the outside, then maybe you want to buy organic of that. So you can kind of pick and choose which ones you want to do. However, if you're not able to afford organic produce, that doesn't mean you should avoid produce altogether. You should still, the benefit outweighs the risk. So you really still want to get those fresh fruits and vegetables. And shopping in season can also be helpful. Farmers markets, usually when that in-season produce comes, it's more affordable. And canned goods. So with canned goods, obviously we want to be careful, drain and rinse to reduce the sodium. There are some brands though that don't add a lot of sodium. For example, one with beans is a brand called Rienzi. There's barely any salt in their beans at all. So draining and rinsing, it's always a good idea to have these on the shelf just in case, you never know, there's an emergency. And frozen foods as well because they don't perish as quickly. So having some frozen vegetables in your freezer if you didn't get a chance to buy anything fresh. And you know, your money can kind of go longer this way. With the fresh fruits and veggies, you do need to eat them within the week for the most part. Sometimes berries even, you know, they can end up going bad quickly. So having a different type, you know, fresh, frozen, canned, emphasis on the fresh, but also, you know, whatever you're really able to afford. And then different colors. Whether if you love canned carrots, fine, that can be your orange. Greens, maybe you want to do that fresh. And I think grains as well. So with grains are pretty affordable. That is one thing. And that's why in a lot of cultures, grains make up a big part of the diet. Like rice. If anyone comes from any Caribbean culture, you might be rice and peas, rice and beans take up half of the plate. And so with grains, you actually want to practice more portion control. Your money may even go further when you are portioning your food out as well.
Thank you so much, Erika. I know I spent a little bit more time about nutrition, but when you talk about chronic illness and when you talk about prevention, we're talking about getting good nutrition in here, and we also want to be able to understand how to afford it and how to make use of what we have here. At this time, I'm going to ask anyone in the audience, we have several mics here. If everyone can stand by your microphones, you can see where someone is standing. If you have questions, I'm going to ask another question here, and then we'll start with our first question.
Oh, I get the first question?
Go ahead.
Good morning. My name is Deneen McNeil. I think I'm going to direct my question to the nutritionist. We live in a Ozempic, Wegovy world. I've been trying to get my hands on it, but I'm one of the people that can't. But how do you feel about people who take, or the drug itself? We know the side effects has been sensationalized about stomach paralysis and those type of side effects. But I've also heard people say, I want to get healthy, so why would I put something in my body that regulates my blood sugar, and I'm not a diabetic, but on the flip side, I could look 20 pounds lighter in less than 6 months. So I just want to know your thoughts about Ozempic and Wegovy.
Okay, as a dietitian, I will weigh in, and a doctor may have something to add. So I think that those medications are useful in some cases. There are people who have health conditions and are at a very unhealthy body weight in which they need to lose weight quickly, and diet and exercise is not bringing them results quickly enough. So in that case, it might be beneficial. However, my issue is when people assume that they can continue eating the way they want and then take this drug, because you really need to get your diet and your lifestyle in the right place. Otherwise, you're going to undo all of your hard work. And so you really have to get these habits established. And then if you don't get any progress or any results, then maybe it's something that can be considered. But I find that a lot of people, once they really do find that, that strength within to commit and have that consistency with diet and lifestyle, they're able to get those results. It doesn't come quickly. The Amazon Prime reference, it takes time. Your body didn't become the way it is overnight, so it's going to take some time to get to where you want to be. And we do need to manage expectations, of course. But first and always should be diet and lifestyle and a real commitment to it. And when I say commitment, that means telling your dietitian or your doctor, this is what I'm not going to do, this is what I am going to do, and this is where I'm willing to budge so that we can help get you there.
Thank you.
And I can just add to that.
Oh, sure.
So in terms of medications, there are medications available, but again, it comes to going back to the basics. We start from changing ourselves, and all these medications are there, and I feel there's a lot of social media giving misinformation. There are facts, there's research, there's side effects, and maybe one person is a candidate for it and not the other. So that's where you come to me. I'm your doctor. I talk to you and I take you through that journey, and we can talk about it and make the right choices. Okay.
Thank you so much.
Thank you. I'm going to take the next question here, but I just want to reiterate that your providers are your partners in getting you to wellness and to great health, right? And so what I've heard Erika say is, let us know that you're not going to do something. Don't walk away from the doctor thinking, oh, the doctor says this, and I go home and I'm doing something different. Or, we just have to establish that trust. And so, again, it's your partner that helps advocate for your wellness.
Hi, thank you for having us here. My question has to do more with gastro system and diet, as diet applies to it. I've been hearing a lot of comments and different ideas with regards to certain vegetables you should or shouldn't eat for leaky gut and lectin issues. I wonder if anyone can address that, because it is a concern of mine, as it is a problem in my family.
Okay, so yes, there has been a lot of information about lectins, leaky gut, and certain vegetables that do or don't cause any issues. Sometimes if you do have gut issues, cruciferous vegetables, for example, cause a lot of gas. And so there are people that have success by reducing the amount of lectins in their diet. Have you tried a low lectin diet?
I have.
Okay. Did you have any success with it?
Actually, I did.
Okay. So yes, so that can be helpful. It doesn't work for everybody, but it does work for some, as well as sometimes if you're having issues with your digestive tract, like IBS, then FODMAP, if anyone's familiar with FODMAP, low FODMAP. Basically, those are types of carbohydrates that are highly fermentable, so they sit in your digestive tract, they ferment, they cause gas and discomfort. And so a low FODMAP diet could be something else that helps. You can do complete elimination and then slowly reintroduce different foods to see what you can tolerate. It might sound a little confusing, but there's a lot of research, and there are some apps that can help. One is Monash University. They have a good app for FODMAPs. So if the lectins, if taking those out didn't completely resolve, then you could also try the low FODMAP. And working with a dietitian is helpful because it can be a lot to handle all by yourself.
So really quickly, for those of us who don't know what lectin is or low FOB, can you just name a food that relates to eating or not eating that?
Right. So lectins are these compounds in certain plants. For example, they're in chickpeas that can cause some harm in your digestive tract and lead to leaky gut. But lectins are in a wide variety of different foods, including some vegetables that are considered nightshades, like eggplant, tomato. And so yes, there's a list of some that are lower and higher than others. Now, FODMAP, I didn't want to say the full acronym, but it stands for fermentable, oligo, mono, and polysaccharides, FODMAP. Fermentable, oligo, disaccharide, monosaccharide, and polyols. So that's what FODMAP stands for. FODMAP, sorry. FODMAP, yes.
Like sauerkraut.
Right. So that's, yeah.
So who is looking for a nutritionist after today? A partner in how to eat healthy, right? Thank you so much for your question. Next question down here.
Hi, my name is Gwen.
Wait, 1 second here. We're gonna go down the line.
Hear me? Oh, here I am. Thank you for the panel and all the rich information. And my question is related to knowledge and information. A comment was made that social media has some false information. When you're over 50 and things are starting to ache and you want to look it up real quick, do you have a go-to online, like WebMD or a particular association that you can go to for just quick information? And that's just a general question for everyone as you're, when you're not at your primary and you just need a quick answer, or to go somewhere, you know, to lead you down a truthful path.
I can answer that question. So there is Google Doc. So I would say refrain from that. I mean, there's a lot of information. I mean, when you type in, you know, ask these questions, you know, it can take you into different websites, but you don't know what's right and what's wrong. So again, making that phone call to your doctor is the first step. You start from there. And I would say going to actually the hospital website and, you know, doing research, because that's more authentic. So you can actually go to Newark Beth Israel website, and if you look under age 50, it will give you all, you know, right information. So I think that would be a safer website than randomly searching.
Excellent.
Yeah.
Thank you.
I want to just piggyback and add one thing. So my mom is notorious for that. About every other week I get a call. I'm going to take X because I just saw that on Facebook, or I saw it on TV. So a caution for everybody is about supplements, because there's a lot of supplements out there. It's a billion-dollar industry, but it's not regulated by the FDA. So you don't really know what you're taking, and it's not consistent. So I think the best thing is, if you're concerned about something, if you have a question about something, reach out to your healthcare provider. It could be a nurse, it could be your local healthcare department in your town. There's resources available that you can tap into. And that's the best way. Just because something works for me may not work for you. And I think that's an important point to make, because, you know, when you go online, those individual things don't exist. It's sort of this general information that you can pick and choose what you want to pick and choose from. And that sometimes is not the most helpful.
Thank you.
Yes, hi, my name is Felicia Bateman, and good morning, ladies, and thank you for your time. My question has to deal with inflammation. There's a lot of information out there about the inflammation and how it has tentacles in all aspects of our health, from our cardiovascular to arthritis to all areas of our life. And I'm just, and this throwing this out there to all of you or anyone, and specifically in terms of the nutritionist, what things can we incorporate in our diet to help us reduce the inflammation and help us, assist us with, joints and things of that nature? And another question is juicing a good additive for that? Thank you.
Thank you for the question. So yes, inflammation definitely does play a role in many chronic diseases, and I'm sure one of the doctors can speak more to that. In terms of food, one thing to do is remove inflammatory foods from your diet. One of the biggest inflammatory foods is added sugars. Also, alcohol. Gasp!
was gonna happen. Last time it was sex, drugs, and alcohol that happened in this room. I knew it was gonna happen.
You notice I hesitated before I said it. Okay, yes. All right. So we do want to remove the inflammatory foods, added sugar, alcohol. Now, 1 drink per day for women is okay. Now, if you don't drink, then you don't want to start. But if you already do 1 drink per day for women, they say is okay, although truly no alcohol is absolutely best. But you know, we've all tasted some good red wine and things like this. And so removing the inflammatory foods, also limiting saturated fat as well. And then in terms of anti-inflammatory foods, you get that from antioxidants. Antioxidants help to fight inflammation in the body. And this is where you want to add in your colorful fruits and vegetables, especially those deep blue, purple, like beets, blueberries, red cabbage, red onions, even, which chard is that? Kale. Any color, any fruit or vegetable that has a very deep, rich color has a lot of antioxidants. And so you want to make sure you're including those daily. And that's also going to help you with any diseases that you are battling. And so if you can get up to maybe 4 or 5 servings per day of vegetables and fruits, then you're doing very good for your body. Now, in terms of juicing, juicing can be a helpful way of getting these nutrients from these vegetables into your body. And notice I said vegetables because we don't want to be juicing fruits all the time. Because basically you'll be making homemade fruit juice, which is better than fruit from concentrate. However, you want to be careful about concentrated sources of juice. And so when you're juicing, if you're juicing vegetables, like celery, maybe a green apple, and a little bit of fruit to sweeten, that's fine. But yeah, juicing can definitely help you with getting those anti-inflammatory nutrients into your body.
Thank you. Before I go to the next question, I wanted to ask this question of Yvette because I know people want to know, especially African American and Latino women are at high risk for a variety of cancers. What should we be looking for and what screenings do you recommend?
So working in oncology, hematology for the past 20 years, we know that racial and ethnicity disparity continues to grow in cancer, especially breast cancer and colon cancer among women. And one of the advices I do give some of my patients is reminders to tell yourself you need screening of your breasts, annual physicals, where your doctors tell you for your age what the appropriate testing is for each such sections. But how do you remember that, right? How do we remember that all these things need to be done? And I always say our birthdays are our best target, because in your birthday, you remember like it's you're taking care of you. And if you remember on your birthday, hey, I have a list of things I need to do at the age when I hit 40 or when I hit 50 or when I hit 60. And when you have your yearly physical around your birthday, all those things can be taken care of you by your providers and get the right referrals to get the right testing to avoid long-term chronic illnesses or acute phases of like you caught it too late or you just forgot. So I think birthdays are our most amazing calendars to remind us of when to get testing done or appropriate testing by your physicians.
Thank you so much. Everybody remember your birthday is all about you, so your health care, right?
Yes, my name is Linda Hines, and my question is for Dr. Kane. I wanted to know about the symptoms for heart attack. A pain in your chin, is that something that indicates something is wrong with your heart?
So everybody's different. So we could. Sometimes you can have some referred pain that kind of goes up your neck into your jaw, and that could be it. But it could also not be a heart attack that's happening. So I think the most important piece of it is putting it all together and how you feel. So you have this jaw pain that you never had before, is there longer than at least 15 minutes. It's not going away. It doesn't get better if you rest, if you stop chewing, if you move. It's kind of constantly there. that is something that you definitely want to get checked out, because it could be something leading to something else. Not necessarily a heart attack, but it could be. Especially if it's associated with like nausea, stomach upset, ire, any of the other symptoms that kind of go along with heart disease.
No, I've just had some type of pain. It's just an annoying pain in my chin. But if I cough, I'll cough and then it'll kind of go away. But it doesn't last for 15 minutes and I don't feel nauseous. But I have experienced this pain in my chin.
Yeah, so
And I don't know why.
This is one of the reasons why we're here today, to make sure that you reconnect or connect with your primary caregivers. If you don't have a primary caregiver, that's why we're here today. We are looking to connect everyone to a healthcare partner and advocate that is either with Newark Beth Israel Medical Center or any of our affiliates, of course, but we want to make sure that we're not ignoring those little signs and symptoms, that we're having conversations not just with our loved ones, but we find a partner here to now walk us through some of the things that we've experienced either one time or something that's nagging us. So thank you so much for asking that question.
Well, good afternoon. I get bloated when I eat bread and some pastas. Is that a sign that I could be allergic to gluten?
That is a sign that you could be. You could be sensitive to it, yes. And the best thing to do with that is to get tested to find out if you have a gluten sensitivity. And you can also take it out of your diet, see how you feel, see how your body is. But it can, I believe the symptoms can last for up to a week or so you need to be off of it for a week.
Okay, thank you.
Great. I'm so glad to see the age of 55 this year, but I couldn't tell you about the stomach that I don't have anymore, right? All the good things that I love to eat as I got older, the things that I can or cannot digest. So again, I think finding that partner, looking at those things that we can take out of our diet to just see what we're doing.
Good evening, everyone. Good afternoon. My question is, being that we have so many food pantries around, and you go and you get food and the can, some of the items are expired, how long should we keep that before we continue to eat it?
Okay, so the food that you receive from the pantry. So a lot of times the dates on packages, if it's expired, you want to get rid of it. Now, sometimes it says best buy, which means you can still eat it, it just isn't going to taste or look as good. But I am curious, how quickly does that date come from some of the items that you've received?
Sometimes it can be 6 months, maybe a year.
Okay. For canned goods, I would say if you really do need the food, maybe up to 6 months after the best buy date. If it's an expiration date again, it should be thrown out. If it's a best buy date, maybe up to 6 months for something canned because it has been preserved. But you do want to be careful. Also, make sure you're smelling the food, looking at it to see if you see any signs of any, if it doesn't smell right, if it looks off. If there's any slimy texture, that's an indication of bacteria, so that means you want to throw it out as well. And if there's any cans, if they are dented or if you see any, if it's misshapen, you also want to throw that out.
Right.
Thank you.
Just one other thing about food pantries and food bank, and I have a soror sister who really runs a great food bank. That we understand that not everybody is able to get things from the grocery store, and sometimes we're using our food banks, but sometimes at the grocery store you're picking up the wrong item too. So I suggest that whatever you're getting, that you're looking at those dates, and feel free to bring it back to that pantry, because it's not with ill intent that food is given out. It is more to make sure that there is widespread, and sometimes it is very close to the date, because that's how we get so many massive abilities to give at a food pantry. So I say whether you're getting it from the grocery store or food pantry or anywhere else, that we are looking at dates, and we get to take it back to the store, we get to take it back to that food bank or pantry as well, okay? I have one more question here, and I'm gonna get back down the lines over this side. Mahtab, we are seeing an increased amount of depression across society, especially with our teens and young adults. And this hit my home very recently. Last December, my 17-year-old cousin committed suicide. So can you talk to us about what you've seen and give us some tools to use to address behavioral health issues in our own lives, our friends, our young adults, our families?
Yes, absolutely. So there is something unique in the last decade where we're dealing with some situations and some realities that we didn't have to just 10 years ago. One being post-COVID pandemic, there's a lot of anxiety amongst women, amongst teens and early young adults, not just depression, because of the isolation and loneliness that has been left from being on such a living in a virtual world, right? Our teenagers, our college student children and friends have been living behind a screen, disconnected, lonely. And that's one of the reasons that just now research is showing that there is a population of young adults, specifically women as well, and young girls that have depression and anxiety that wasn't as apparent before. Another contributing factor that's very recent is social media. Again, especially for our women and young girls, you know, we're looking at content and material on social media that's not based on reality. I'm looking at, even as adults, right? I'm 38 myself. I look at other moms, other working moms. They look a certain way and they're vacationing a certain way and they're living a lifestyle that's not actually reality, but that's becoming my source of truth. Now imagine I'm a clinician, I'm an educator, so I have some tools that kind of, you know, are a dialogue that could tell me, you know, this is just social media, this is a glimpse of somebody else's life. But a young girl, they look at that, and that's what now I'm comparing myself to, and how that could chip away at our building self-esteem and self-confidence. So that's another very unique contributing factor that's new in the last decade with social media. And another piece of social media is bullying, the silent bullying, unfortunately, that's happening on social media. So unless we as caregivers are kind of checking in with our children, with our neighbors about what, you know, what are you seeing on Facebook? You know, what do the conversations look like? What are your friends are saying about you? Our teenagers and children, unfortunately, might not have the language to say, hey, mom, or to see the red flags, right? To say, hey, this doesn't feel good. This doesn't sound good. Somebody's talking about me. There's a lot of gossip going around. So it's very silent, and it's happening on screen. So we as adults are not seeing it. Teachers are not seeing it. So then it could go on and on and on, and then now we have a 17-year-old and 18-year-old with clinical depression, with anxiety, isolating, not wanting to go to school, not wanting to pursue work. So yeah, I would say, you know, social media is very unique. Bullying in social media and post-COVID, the isolation and the virtual world that we had to live in. One thing that, you know, I'm very cognizant in the work that we're doing right now and research teaching us is about building emotional resilience. You know, the same thing that we're talking about here is about prevention with our bodies and health. The same thing applies to our emotional wellness, right? It's not about if I'm crazy or if I'm depressed or this person's, you know, they got schizophrenia, they got bipolar, they're on medication. It goes beyond that. We all have emotional health. We all have mental wellness that we need to maintain. And, you know, I always compare it to a muscle. Just like I need to exercise my muscle and my joints to be healthy, I need to exercise and know how to build my emotional wellness muscle. And that also is part of a lifestyle. It's the same thing. It's what am I eating? What am I doing with my body? Who am I connecting to? Am I talking about my feelings, my emotions? So those are some very simple way that day to day that we could build our emotional resilience so that when we do face hardship, when we do face stress, when we do face grief and trauma, we're equipped to move through it a little bit easier, a little bit faster.
I'm so glad you brought up emotional resilience, because when we say resilience, we are usually thinking about something physical, right? And so your mental capacity and wellness is so very important. I know we do still have a lot of questions in the room, and we have a short period of time, so I'm going to ask if there are any other questions in the audience and you did not get a chance to come to the mic, because we're going to shut the line down now, that you make sure that a part of your evaluation, you put it on there, and we'll make sure that a healthcare provider gets back to you with your questions, okay? And so I'm going to go back to this mic here. Those who are standing, please continue to ask your questions, and I'm going to ask you all to be a little brief.
Okay. Hi, my name is Cheryl, and I want to thank everybody on the panel. My question is about vitamins. I think Dr. Khan spoke on supplements. I've always bought them, but now I actually take them on a regular basis. And do they really work? I've heard that different vitamins, some are more absorbent than others. Do they really, like the nutrients that we're not getting? Are we getting them from our one-a-day?
So the vitamins again, that conversation again goes back to your healthcare provider. So, there is a lot of talk about taking vitamins, but when a patient comes to me, I assess what kind of vitamin is necessary, what's the deficiency, and based on that we recommend. Because there are certain things there's a certain condition called hypervitaminosis where if you're taking a lot of vitamins, it can cause harm. So that's why taking vitamins, if you're eating a healthy diet, I would say that's good enough to supplement your body. Anything beyond that, I think you should talk to your provider so they can understand what really your body needs. And we are able to do that with blood work, exactly find out what vitamin you're deficient in.
Thank you. What I'm hearing in the room is to get that provider partner. Next.
Yeah. Good afternoon. I have a specific question about thyroid. My thyroid was removed about 10 years ago. So I don't know if anybody on the panel could respond to questions about the medication.
So again, I would say it's a very specific question.
Yes.
You would want to go back to your healthcare provider so they can do a blood work and understand what you need.
Okay, it's really general. I got I asked two providers, healthcare providers, and I got different answers. So that's why I'm trying to put the information together and also on what I read up on about it. So the two medications they like to give out is the levothyroxine and the Synthroid. And I recently found out that those are hormone stimulating drugs. So, and what I think they meant by that was that those drugs stimulate your thyroid to produce more or less hormone.
Right.
Is that the case?
Yeah. So very specific questions to your specific, right? And so what we'd like to do is connect you with a provider after here. But if there are any other generic thyroid questions, and not just thyroid, healthcare questions, I think what we got out of here at the most, and I understand if you're getting two different answers, you would love to sit down with someone. And again, I think I tell this to my mother all the time. She has lots of different doctors, but she has one pharmacist, right? Because again, and we don't have a pharmacist on the panel today, but sometimes when you're having some of the different drugs and you're going to different doctors, and everybody, thank God for Epic and some of the other electronic medical records that your providers can see your medication profile, but sometimes there's a contraindication. And so I'll make sure that one of our providers speak to you directly so we can get you in the right pathway.
Okay,
Thank you. Thank you.
Mm-hmm.
Okay, hello. My name is Hilda Venegas. My question is, my understanding is 5 portions a day for vegetables or fruits is necessary for you. I don't think nobody can have 5 of them a day. I mean, maybe 2. How about, what is your idea about the supplements like Juice Plus pills or vegetable and fruit pills that help in some way cover up that left?
So you're talking about, sorry, the fruit and veggie powders?
No, I'm talking about the pills. They have like a juicy, like a fruit or vegetable pills. Like supplements,
Okay.
correct.
So with supplements, they're not as effective as consuming the whole fruit itself. If you want a quick way, you could do a smoothie, but if you're going to do a smoothie, I'd say try not to put too much fruit, because again, then that sugar gets absorbed quickly. You want to put lots of veggies in there. So a smoothie is a good way to get some fruits and veggies in if you don't have time to be cooking things up and spreading them throughout the day. But yeah, those fruit and veggie supplements, I'm not sure the effectiveness of them, but you're really better off getting it from the whole food itself.
But 5 portions a day of
Yeah, one portion is considered a half a cup. Or like a small to medium apple.
Okay. Thank you.
It looks like we've run out of time for questions, and I know there are 3 people who are still standing at the mics, and what I'm going to do is apologize to you in advance as I'm getting the wind it up signal. However, your questions are very important. I'm going to ask you to meet me at the end of this, at the front of the stage. That way we can answer your specific questions directly to you, okay? Thank you so very much. And so I want to say thank you to our esteemed panelists for giving us such great information at this time. Again, our panelists are going to be here for quite some time throughout the program of the day. If you have some specific questions that we'll be able to answer some questions directly for you. We'll also have a group of team people here to connect you to healthcare services at Newark Beth Israel Medical Center and Children's Hospital of New Jersey. And we have an evaluation form that you'll be able to ask your questions to. And as long as you put your email address on there, we'll get those answers back directly to you. And we'll have a frequently asked questions survey that goes out as well. Thank you so much for your time in this panel.